Welcome back to Mom Hacks and Tips. Today, we're tackling a question that causes so much confusion and anticipation. Is it implantation bleeding or just my period? We're here to clear up the uncertainty. To help us distinguish between the two, we're thrilled to have Dr. Evelyn Reed back with us. Welcome, Doctor.
Thank you for having me, Daniel. This is one of the most common questions I get, and I'm happy to provide some clarity for your listeners.
To start, can you explain what is happening in the body during implantation bleeding?
Implantation bleeding is light spotting that can occur when a fertilized egg attaches or implants into the lining of the uterus. This happens about 6 to 12 days after conception and is considered one of the earliest signs of pregnancy.
How does the timing of implantation bleeding differ from a typical menstrual period?
Timing is a key differentiator. Implantation bleeding usually occurs a few days to a week before you would expect your period to start. A menstrual period, by contrast, marks the beginning of a new cycle and arrives on or around the day it is due.
What about the appearance? How can someone tell the difference based on color and flow?
The appearance is very different. Implantation bleeding is typically a light pink or brown color, resembling spotting rather than a true flow. A period usually starts light red or pink, but quickly progresses to a heavier, bright red flow that requires a pad or tampon.
And what is the difference in duration?
Implantation bleeding is very brief. It might last only a few hours or at most a couple of days. A normal menstrual period is much longer, lasting anywhere from 3 to 7 days for most women.
Are there different accompanying symptoms we can look for example, with cramping?
Both can be associated with cramping, but the sensation is often different. Implantation cramps are typically mild and fleeting, described as a pulling or tingling feeling. Menstrual cramps are often more intense, persistent, and can precede a heavier flow.
If a woman suspects she is experiencing implantation bleeding, what other early pregnancy signs might she notice?
Alongside the spotting, she might experience other classic early pregnancy signs such as unusual fatigue, breast tenderness, nausea, or a heightened sense of smell. These symptoms are caused by rising pregnancy hormones and would not typically accompany a period.
For our listeners trying to make sense of all these signs, what do you recommend for keeping track of it all?
I strongly recommend using a tracking tool. This is where the free daily tracker on mymiracleplan.online is so valuable. You can log the date, color, and amount of any spotting, along with any other symptoms you're feeling. This creates a clear record to help you understand what's going on.
Before we continue, I want to take a moment for an important announcement for all our new and soon-to-be moms. Are you feeling overwhelmed by planning for your new arrival? Do you wish you had a one-stop resource for everything from pregnancy to postpartum? Then you need to visit mymiracleplan.online. It's packed with free tools designed just for you, including an amazing AI name generator, a week-by-week pregnancy timeline, and essential guides on postpartum care. You'll also find countless parent resources, expert articles, a new baby plan, a daily tracker, and even natural recipes. It's all there to support you on your journey. Go to mymiracleplan.online to get started today. Dr. Reed, if a woman sees what she believes is implantation bleeding, when is the right time to take a pregnancy test?
The best practice is to wait until the day you expect your period or a day or two after it's missed. Home pregnancy tests work by detecting the hormone HCG, which needs time to build up to a detectable level. Testing too early can lead to a false negative, causing unnecessary confusion and disappointment.
When should bleeding be a cause for concern and prompt a call to a doctor?
You should always contact a healthcare provider if you experience bleeding that is heavy, bright red, and accompanied by severe pain, cramping, dizziness, or a fever. While light spotting can be normal, it's crucial to rule out other issues like an ectopic pregnancy or other complications.
This has been incredibly helpful. To summarize for our listeners, what are the key points to remember when trying to tell the difference?
Remember the 3 C's: color, consistency, and calendar. Implantation bleeding is typically brown or pink. The consistency is light spotting, and its place on the calendar is before your expected period. A period is usually red, has a heavier flow, and arrives when expected.
Dr. Reed, thank you once again for sharing your expertise and bringing so much clarity to this topic.
It was my pleasure, Daniel. My final piece of advice is to listen to your body, be patient, and remember that resources like mymiracleplan.online are there to support you every step of the way.